After studying this module, you shall be able to know about the core signs and symptoms of dementia and Parkinson's disease. Learn about the various subtypes of dementias. Understand the underlying causal factors. What is dementia? Dementia, which is taken from Latin word originally meaning madness from D, without, plus meant the root of men's mind, is a serious loss of global cognitive ability in a previously unimpaired person beyond what might be expected from normal aging. It might be static, the result of a unique global brain injury, or progressive, resulting in long-term decline due to damage or disease in the body. Although dementia is far more common in the geriatric population, about 5% of those over 65 are said to be involved. It can occur before the age of 65, in which case it is termed early onset dementia. Dementia is not a single disease, but a non-specific syndrome, that is set of signs and symptoms. Dementia is a term used medically to describe a syndrome, set of symptoms that is caused by many different diseases. These include Alzheimer's disease, vascular dementia, dementia with Lewy bodies. The dementia syndrome is defined as an acquired decline in memory and thinking, that is cognition, due to brain disease that results in significant impairment of personal, social or occupational function. Other brain functions that are affected include orientation, comprehension, calculating ability, learning capacity, language, judgment, reasoning, and information processing. The World Health Organization or WHO guidelines recommend that these symptoms and impairments be evident for at least 6 months before a confident diagnosis can be made. While most dementias are currently irreversible, this does not mean that dementia is untreatable. Its progression can often be influenced by many symptoms, can be ameliorated. Most dementing illnesses are progressive, and early symptoms and problems differ markedly from those in later stages. Stages of dementia. First is pre-dementia or questionable dementia or mild cognitive impairment. Under this, there is no set pattern. The various symptoms may occur independently of or each other and are often only recognized retrospectively. Subjective awareness of short-term memory deficits and or close friends or relatives notice a mild change. Depression and anxiety along with other non-specific behavior or memory changes. Personality changes such as apathy and irritability often attributed to age or depression. Close relationships might become strained, less social and hobby activities. Work performance, decision making and problem solving difficulties may occur. The next stage is mild or early dementia. Consistent deficits across a range of domains, however, usually still able to function with minimal assistance. There is impairment in short-term memory, which interferes with day-to-day functioning, for example, losing keys, forgetting conversations, etc. Some disorientation in time, for example, date, may become disoriented when in unfamiliar places. Some word finding difficulties, names, objects, etc. Obvious difficulties with problem solving, especially in novel situations. Difficulties in social functioning, for example, shopping, finances or business affairs, though may superficially appear normal and engage in them. More difficult household tasks no longer done and less interest in hobbies. They may require prompting in personal care as well. Moderate or middle stage dementia. More severe deficits clearly needs assistance from a carer to function at a level comparable to before onset of dementia. Severe memory loss and rapidly forgets new information, usually disoriented in time and often as to place. Obvious difficulties in finding words, often doesn't speak spontaneously, starts to misidentify familiar people. Problem solving and judgment is very poor, unable to function independently in social situations, but is usually able to attend with supervision. Only able to perform simple chores at home, requires assistance with personal care. Behavioral difficulties emerge, for example, wandering, agitation, aggression, psychosis, sleep disturbance, etc. The later stage is called the severe stage. There is no semblance of independent function. The majority of persons with severe dementia are in residential care. Very severe memory loss, only fragments remain. Oriented to person only, is unable to solve problems or make judgments. Language skills limited to a few words and phrases. Regularly misidentifies familiar people. Social function is minimal even with supervision. No significant self-care capacity. Frequent incontinence and behavioral difficulties increase. Then advanced dementia. These people are completely dependent on carers for all aspects of daily living. No semblance of memory function. Usually they may be inarticulate or may be mute. They cannot identify familiar people. Very poor comprehension of simple verbal commands. Social interactions virtual non-existent. May lose capacity to stand, walk and sit up. Incontinence of urine and feces. Now the types of dementia. Some of the most common forms of dementia are Alzheimer's disease. This is the most common form of dementia and there is no cure for the disease, which worsens as it progresses and eventually it leads to death. Most often, Alzheimer's disease is diagnosed in people over 65 years of age, although the less prevalent early onset Alzheimer's can occur much earlier. Although Alzheimer's disease develops differently for every individual, there are many common symptoms. Early symptoms are often mistakenly thought to be age-related concerns or manifestations of stress. In the early stages, the most common symptom is difficulty in remembering recent events. When Alzheimer's disease is suspected, the diagnosis is usually confirmed with tests that evaluate behavior and thinking. Abilities often followed by a brain scan if available. However, examination of brain tissue is required for a definitive diagnosis. As the disease advances, symptoms can include confusion, irritability, aggression, mood swings, trouble with language, and long-term memory loss. As the sufferer declines, they often withdraw from family and society. Gradually, bodily functions are lost, ultimately leading to death. Since the disease is different for each individual, predicting how it will affect the person is difficult. Alzheimer's disease develops for an unknown and variable amount of time before becoming fully apparent, and it can progress undiagnosed for years. On average, the life expectancy following the diagnosis is approximately 7 years. Then we have vascular dementia or multi-infarct dementia. In this, dementia is caused by problems in the supply of blood to the brain, typically by a series of minor strokes. Vascular dementia is the second most common form of dementia after Alzheimer's disease in older adults. Multi-infarct dementia is thought to be an irreversible form of dementia, and its onset is caused by a number of small strokes or sometimes one large stroke preceded or followed by other smaller strokes. The term refers to a group of syndromes caused by different mechanisms, all resulting in vascular lesions in the brain. Early detection and accurate diagnosis are important, as vascular dementia is at least partially preventable. The main subtypes of this disease are mild cognitive impairment, multiple infarct dementia, vascular dementia due to a strategic single infarct that is affecting the thalamus, the anterior cerebral artery, the parietal lobes, or the cingulate gyrus, vascular dementia due to hemorrhagic lesions, and mixed Alzheimer's and vascular dementia. Vascular lesions can be the result of diffuse cerebrovascular disease such as small vessel disease or focal lesions, usually both. Mixed dementia is diagnosed when patients have evidence of Alzheimer's disease and cerebrovascular disease, either clinically or based on neuroimaging evidence of ischemic lesions. In fact, vascular dementia and Alzheimer's disease often coexist, especially in older patients with dementia. Frontotemporal dementia is a neurodegenerative disease characterized by severe frontotemporal lobar degeneration. The most common symptoms include significant changes in social and personal behavior, as well as a general blunting of emotions. Currently, there is no cure to this disease, but there are treatment options available that help alleviate the symptoms. Symptoms can begin to appear on average around 45 to 65 years of age, regardless of gender. Lewy body dementia, which is a type of dementia closely associated with Parkinson's disease. It is characterized anatomically by the presence of Lewy bodies, clumps of alpha synuclein and ubiquitin protein in neurons detectable in post-mortem brain histology. Lewy body dementia is a progressive degenerative dementia of the elderly. Its primary feature is cognitive decline, partially of executive functioning. The patient will display an inability to plan or a loss of analytical and abstract thinking. Persons with LBD will show markedly fluctuating cognition. Wakefulness will vary from day to day, and alertness and short-term memory will rise and fall. Persistent or recurring visual hallucinations with vivid and detailed pictures are often an early diagnostic symptom. Parkinson's disease. It is a degenerative disorder of the central nervous system. Early in the course of the disease, the most obvious symptoms are movement related. These include shaking, rigidity, slowness of movement, and difficulty with walking and gait. Later, thinking and behavioral problems may arise, with dementia commonly occurring in the advanced stages of the disease, whereas depression is the most common psychiatric symptom. Other symptoms including sensory, sleep, and emotional problems. Parkinson's disease is more common in older people, with most cases occurring after the age of 50. The main motor symptoms are collectively called Parkinsonism or a Parkinsonian syndrome. Parkinson's disease is often defined as a Parkinsonian syndrome that is idiopathic, that is having no known cause. Although some atypical cases have a genetic origin, many risk and protective factors have been investigated, the clearest evidence is for an increased risk of PD or Parkinson's disease in people exposed to certain pesticides and a reduced risk in tobacco smokers. Now, the signs and symptoms of Parkinson's disease. The disease affects movement, producing motor symptoms, non-motor symptoms, which include autonomic dysfunction, neuropsychiatric problems, that is mood, cognition, behavior or thought alterations, and sensory and sleep difficulties are also common. Some of these non-motor symptoms are often present at the time of diagnosis and can precede motor symptoms. Motor. 4 motor symptoms are considered cardinal in PD: tremor, rigidity, slowness of movement, and postural instability. Tremor is the most apparent and well-known symptom. It is the most common, though around 30% of the individuals with PD do not have tremor at disease onset. Most develop it as the disease progresses. It is usually a rest tremor, maximal when the limb is at rest and disappearing with voluntary movement and sleep. It affects to a greater extent the most distal part of the limb and at onset typically appears in only a single arm or leg, becoming bilateral later. A feature of tremor is pill rolling, the tendency of the index finger of the hand to get into contact with the thumb and perform together a circular movement. Bradykinesia, that is slowing of movement, is another characteristic feature of PD and is associated with difficulties along the whole course of the movement process, from planning to initiation and finally execution of a movement. Performance of sequential and simultaneous movement is hindered. Bradykinesia is commonly a very disabling symptom in the early stages of the disease. Initial manifestations are problems when performing daily tasks which require fine motor controls such as writing, sewing or getting dressed. Bradykinesia is not equal for all movements or times. It is modified by the activity or emotional state of the subject, to the point that some people are barely able to walk yet can still ride a bicycle. Generally, people with PD have less difficulty when some sort of external cue is provided. Rigidity is stiffness and resistance to limb movement caused by increased muscle tone or excessive and continuous contraction of muscles. In Parkinsonism, the rigidity can be uniform, which is called lead pipe rigidity, or ratchety cogwheel rigidity. The combination of tremor and increased tone is considered to be at the origin of cogwheel rigidity. Rigidity may be associated with joint pain, such pain being a frequent initial manifestation of the disease. In early stages of Parkinson's disease, rigidity is often asymmetrical and tends to affect the neck and shoulder muscles prior to the muscles of the face and extremities. With the progression of the disease, rigidity typically affects the whole body and reduces the ability to move. Postural instability is typical in the late stages of the disease, leading to impaired balance and frequent falls, and secondarily to bone fractures. Instability is often absent in the initial stages, especially in younger people. Up to 40% may experience falls and around 10% may have falls weekly, with number of falls being related to the severity of PD. Other recognized motor signs and symptoms include gait and posture disturbances such as festination, that is rapid shuffling steps and a forward flex posture when walking, speech and swallowing disturbances including voice disorders, mask-like face expression, or small handwriting, although the range of possible motor problems that can appear is large. Neuropsychiatric. Parkinson's disease can cause neuropsychiatric disturbances, which can range from mild to severe. This includes disorders of speech, cognition, mood, behavior, and thought. Cognitive disturbances can occur in the initial stages of the disease and sometimes prior to diagnosis and increase in prevalence with the duration of the disease. The most common cognitive deficit in affected individuals is executive dysfunction, which can include problems with planning, cognitive flexibility, abstract thinking, rule acquisition, initiating appropriate actions, and inhibiting inappropriate actions, and selecting relevant sensory information. Fluctuations in attention and slowed cognitive speed are among other cognitive difficulties. Memory is affected specifically in recalling learned information. Nevertheless, improvement appears when recall is aided by cues. Visuospatial difficulties are also part of the disease, seen, for example, when the individual is asked to perform tests of facial recognition and perception of the orientation of drawn lines. A person with PD has 2 to 6 times the risk of dementia compared to the general population. The prevalence of dementia increases with duration of the disease. Dementia is associated with a reduced quality of life in people with PD and their caregivers, increased mortality, and a higher probability of needing nursing home care. Behavior and mood alterations are more common in PD without cognitive impairment than in the general population and are usually present in PD with dementia. The most frequent mood difficulties are depression, apathy, and anxiety. Impulse control behaviors such as medication overuse and craving, binge eating, hypersexuality, or pathological gambling can appear in PD. Psychotic symptoms, hallucinations, or delusions occur in 4% of people with PD. Other symptoms. In addition to cognitive and motor symptoms, PD can impair the other body functions. Sleep problems are a feature of the disease and can be worsened by medications. Symptoms can manifest as daytime drowsiness, disturbances in REM sleep, or insomnia. Alterations in the autonomic nervous system can lead to orthostatic hypotension, that is low blood pressure upon standing, oily skin and excessive sweating, urinary incontinence and altered sexual function. Constipation and gastric dysmotility can be severe enough to cause discomfort and even endanger health. PD is related to several eye and vision abnormalities such as decreased blink rate, dry eyes, deficient ocular pursuit, that is eye tracking, and saccadic movements, that is fast automatic movements of both eyes in the same direction, difficulties in directing gaze upward, and blurred or double vision. Changes in perception may include an impaired sense of smell, sensation of pain and paresthesia, that is skin tingling and numbness. All of these symptoms can occur years before the diagnosis of the disease. To summarize this module, first of all, dementia is a set of non-specific symptoms characterized by global cognitive deficits. It is progressive in nature and has associated behavior and personality changes. There are many types and forms of dementia, the most common being the Alzheimer's disease, vascular dementia, Dementia with Lewy bodies. Each type is characterized by specific causal factors. Alzheimer's disease is the most common form of dementia. There is no cure for the disease, which worsens as it progresses and eventually leads to death. Most often, AD is diagnosed in people over 65 years of age. Although the less prevalent early onset Alzheimer's can occur much earlier. Vascular dementia or multi-infarct dementia is dementia caused by problems in the supply of blood to the brain, typically by a series of minor strokes. Vascular dementia is the second most common form of dementia after Alzheimer's disease in older adults. Frontotemporal dementia is a neurodegenerative disease characterized by severe frontotemporal lobar degeneration. Lewy body dementia is a type of dementia closely associated with Parkinson's disease. It is characterized anatomically by the presence of Lewy bodies, clumps of alpha-synuclein and ubiquitin protein in neurons, detectable in post-mortem brain histology. Parkinson's disease is a degenerative disorder of the central nervous system early in the course of the disease. The most obvious symptoms are movement related. These include shaking, rigidity, slowness of movement, and difficulty with walking and gait. Later, thinking and behavioral problems may arise with dementia, commonly occurring in advanced stages of the disease, whereas depression is the most common psychiatric symptom.